The Source checks in now with Dr. Mustafa Hirji, Niagara's Medical Officer of Health. Dr. Hirji, we're seeing numbers increase all over Ontario, but Niagara has been able to hold its own to some degree so far. What is the reason for that?
Number one, I think there's just some luck involved in this, and we've perhaps got a little bit lucky. I look across our border at Hamilton, and of course, they've had the well-publicized large outbreak at that spin class, and so we've fortunately avoided some of that. So that luck has helped us. I think the other things though that help us is that we are a bit farther away from the GTA and Peel, York Region, Toronto, where they're having the real brunt of the cases. So there's a little bit perhaps less travel due to that and less of the interaction that's leading to spread of infections here. There's been a lot of hard work, of course, by us in public health about identifying every case, finding their contacts, ensuring everyone's isolated to stop the spread of infection. And then finally, I think we've been trying to get the message out to the public about the importance of limiting their social circles, having fewer contacts.
Leading up to Thanksgiving, there was a lot of talk about making sure that people didn't invite people outside of their bubble for big family gatherings, and that we might see the results on how we did on that aspect 2 weeks after Thanksgiving. We're there pretty much right now. It looks like we obeyed that command. Is that what you would assume?
It's too early to say yet. I think over the next few days and up to the next week, we will really see the impact for sure. So a week from now, I think I'd be more confident in making a statement. What I did hear anecdotally is that there were a lot of people who decide to cancel their usual Thanksgiving plans and really have a more small, intimate household gathering. And I think that's really great. And hopefully enough people did that we're able to stop the spread of infection.
You mentioned the spin class in Hamilton, almost 100 cases there by the end of this week. Does that make people think twice about going back to the gym, going back to environments like that?
You'd have to ask the public themselves of what their reaction to it is. To me, it certainly tells me that there is a potential risk in some of these facilities. And I think the gyms are doing a lot of good things to limit the spread of infection. We aren't seeing many of these outbreaks. This has got a lot of attention because it's quite unusual that you have an outbreak, particularly one that has that many people. So for the most part, I think gyms are safe. I think what we can perhaps learn from the spin class is that maybe the restrictions we have in gyms and the measures we're taking maybe need to be tweaked a little bit more.
Are we doing enough in Niagara to make sure that we don't have uncontrollable outbreaks again in the seniors and long-term care homes?
It's hard to ever know if you've done enough until you find out it hasn't been enough. I think we have seen that thus far, we haven't seen those really large outbreaks that we saw earlier on. We're seeing a lot of very small outbreaks where you still get the first or second case, but it's very quickly contained from there, and those outbreaks come to an end relatively quickly. We have seen a few outbreaks that have grown a little bit larger than we would like. Certainly not ballooning to what they were in the spring, but larger than we'd like. So there is still more work we need to do in terms of building the supports and help for these facilities.
There's been quite a few schools. Every week, a couple of new schools announcing that there has been some COVID positive tests. Does that concern you, or is it still at about the level that you would have expected at this point?
1 out of every 7 people in Niagara is either a student or a staff person at school. And so we'd expect 1 out of every 7 cases we have in the community is going to be in some way in the schools. And so if you think about how many cases we're seeing a week, it's not surprising that we're seeing cases getting to schools. Actually, we're probably doing better than 1 out of every 7. So I think, it's not unexpected we're seeing these cases in schools. And hopefully as we bring the cases down in the community again, we can actually see that number go down proportionally. What is really reassuring, though, is we're not seeing very much spread of infection within the schools. We get a case, it's linked to a school. Unfortunately, it disrupts a lot of people's lives because people have to be isolated, but nobody really additional is getting sick. Where people have gotten sick, it's 1, max 2 people, and then everybody goes back to school and things return back to normal. So I think that's a really good news story, that we're not seeing school outbreaks.
There was an announcement that there was a private company offering private COVID testing in the Toronto area, I believe. Is this a dangerous concept moving forward?
I really can't comment too much because I don't know enough about that lab. I think the really important thing for me is that if a lab is doing that kind of private testing, that they are accredited. And so they're going to be doing testing that is going to be reliable and using Health Canada approved tests. I don't think it's terribly helpful, though, to have these private companies doing tests, because anybody who needs a test is able to get it through publicly funding. And so presumably this is so people who don't need tests can get tested. And I'd rather have that capacity actually moved into the public system so we can deal with, some people are waiting a day or two longer than they would like to get tested. And we can make sure that those people who need tests are getting those tests more quickly.